Hi, Rupal.
Hi, Andy.
Lovely to meet you, and thank you very much for agreeing to this interview. Can I ask you to introduce yourself to begin with, please?
Hi, my name is Rupal Lovell-Patel. I'm the chair of the local eye health network for East Anglia. I'm also an optometrist, and I work in independent practice in Sudbury in Suffolk. And a lot of the time, I also teach trainee optometrists in the region and then work for the NHS.
Thank you. 4 different jobs. All right, that's good. Rupal, thank you. I've got 4 questions for you. And my first one is this. How have you been looking after yourself during this pandemic?
Well, with the 4 jobs, as you mentioned, Andy, it is very busy. But I think one of the few things that I have enjoyed working is having a routine. So I know a set time to wake up and set time to log off from work, and then spending some time in the garden and going for walks around the village as well. With the 4 jobs normally, I tend not to have known what's happening in the village, but now during the pandemic, actually, it's been nice to explore the village and see different people's gardens, see how they progress. So spending that time outdoors, but also making sure when I'm working, I'm taking regular breaks from the screen so my eyes don't get tired or dry.
Good. Well, if you didn't know that, then nobody else would.
Yes.
Thank you, Rupal. My second question is this. Where within the primary care setting does optometry fit in?
So a lot of people wonder what an optometrist does and what the difference is between them and an ophthalmologist. An ophthalmologist is a trained doctor who then specialized in surgery of the eyes. But an optometrist, in terms of the whole eye care provision, I would see them equivalent to a GP. So they specialize in eyes. They look at not just what a person needs for the prescription, but they also assess the health of the eye. And eyes being connected to the rest of the body, also we can assess for general health issues. Now, amazingly, the eye is the only part of the body where we can actually see the blood vessels without any skin or any tissue. So if there are issues with the circulatory system or the cardiovascular system, we can actually check for those things. So an eye test is not just for finding what prescription you need or what specs you need, but actually it's giving you an idea of the overall health. So I would say an optometrist is probably a GP for the eyes.
Wow. I knew a little bit of that, but not all of it. Can you give me some examples of what an optometrist can find? Is it maybe diabetes, for example?
So we can look for changes in the eye due to diabetes. Usually one of the first signs we see is a shift in the prescription. So sometimes if you have an undiagnosed sugar levels that are too high, we see a shift towards more short-sightedness. We can see changes in the back of the eye due to high blood pressure. We can see cholesterol deposits in the eye as well. And one of the other big things we tend to look for is if there's any problems with the connection between the eye and the brain, so anything happening in the brain. And one of the things we do tend to pick up is benign tumors of the pituitary gland, because it sits just above a crossing point of where the 2 nerves on the eye go across. And if there is a tumor on it, it presses against it, and we can pick those things up as well.
Fascinating. And do you have a referral system as a GP might have with secondary care?
Yes. So in Suffolk particularly, we refer through a referral triaging system, and it can go either to the hospital in ophthalmology department, or it can go to a GP. So if it's something like an undiagnosed diabetic symptoms, we'd probably send the patient and tell them, go see your GP, ask for blood tests as well, and we'd write a note to the GP to explain why we're asking them to have all these checks. If we think it's more eye related, then we'd refer them to the hospital, to the ophthalmology department, to have something looked at in the eyes. Even if it's neurology, then we'd still go through the eye department in the hospital, and they can then refer them to their colleagues in neurology if needed.
Fantastic. Thank you. Thanks for explaining that. My third question is this. So what have been the the positives for the primary care eye care clinicians during this coronavirus pandemic?
Usually, optometrists and optical practices are not considered primary care settings. People look at them as more as a commercial or retail setting because it's involved more with the sales of specs and contact lenses. But actually, during the pandemic, during all of this planning, optical practices remained open, even though they may not see patients face to face. They were triaging emergency cases, they were taking phone calls, doing remote consultation, and we were considered within the primary care function with dentists, with pharmacists and GPs. The commissioners were actually asking for the input and wanted optical practices involved in the overall care for the patients. So it gave us a voice, it gave us some recognition that actually we are crucial in the whole health economy. We're not just there for giving people better sight through spectacles, but we are there to look at eye health conditions and people who may feel kind of isolated or feel that they're not contributing because their vision's not that good. We can help them achieve better vision, better quality of life as well.
Did you find that people were less likely to come to an optician during this pandemic because of fears and also social distancing?
There were, and a lot of them preferred to go and see a GP, but then luckily enough, our primary care colleagues like pharmacists and GPs were actually telling patients, go and see or contact your optical practice, because if we might not see them in the practice, we can give them advice and guidance on the telephone, or as we're doing now, a video call on FaceTime or WhatsApp. And actually a lot of optometrists and optical practices were doing that. We embraced the online technology. We were doing lots of video calls. Patients were taking pictures of their eyes and sending them in as well with the smartphone technology. So we could do a lot of care that was online, which didn't need to be face-to-face.
Fantastic to hear. Thank you. Last question now, and it's about looking to the future. So what would the eye care professionals in Suffolk want to see continue from COVID-19?
I think Suffolk as a commissioning group, ICS, was proactive in terms of optometry and eye care. They provided PPE to practices that were still seeing some face-to-face. When they had to commission the emergency eye pathway, they consulted with the local optical committee. And I think having that space on the table with the commissioners, listening to the views of the local community, I think makes it much easier to plan for the healthcare provision, the longer term plan across all sectors as well. And I think that made them feel that actually they were part of the team and their input was valuable. And I think taking that forward would be great, but also trying to make sure that they are integrated in terms of technologies and IT and communication routes as well. So that would be good if we could get some integration with primary care as well as secondary care communications.
That's a very clear message throughout this interview, is that you, if I'm right, that you feel that you haven't been on a level playing field with your primary care partners, but there's an opportunity for this to happen in the future.
It is, because eye care is not fully NHS funded for every patient. Some people have to pay for it, and only a very limited number of people get their NHS funded eye examination eligibility. So it's meant that people have felt, oh, actually, I'd rather go and see a GP or a pharmacist when I don't have to pay for it. But actually, they might have to then wait longer or not have the right solution because they haven't been to see an optometrist, which they might have to pay. But there are pathways out there where other commissioners nationally have commissioned things like minor eye conditions, which the ICS or the CCG pays for. And that has no eligibility criteria. If you're registered with the GP, then you get that emergency or that urgent appointment paid for. So, if we think about that, and if we can utilize the experience and the skill that the optometrists and the dispensing opticians have in an optical practice, I think that would help the community a lot.
That helps to know. Is there this is probably something that's impossible, but is there a single page, NHS page, that a patient could actually head towards and look up for anything like that you've just described?
So NHS Choices has that information, and if you say NHS eligibility for eye test, it will give you who is eligible for an eye test. Children under 16, definitely. Anyone who's over the age of 60 is also eligible for an NHS eye test. And then people who have things like diabetes or glaucoma in the family, once they're over the age of 40, they can get an NHS funded eye examination. So it does limit the groups a little bit, but it is available, and we would recommend, every 2 years for people to have their eyes tested, regardless of whether they feel they need new spectacles or not, because it's about the health check.
Quite right. Thank you, Rupal, very much for a very interesting interview. Thank you.
Thank you.